I mentioned, is finding solutions for your myeloma side effects. We know that if you're in active treatment, chances are that you experience side effects daily. Even those who are not in active treatment can still experience side effects due to the myeloma or the havoc that treatments did to affect their body. The HealthTree Foundation, aka us, are passionate about helping ease the burdens of your myeloma journey, and this includes easing the burden of your side effects. I'm excited for you to learn today about not only how you can ease your own side effects, but how you can help others ease theirs and contribute to important myeloma research. I'll introduce our two speakers, or our two helpers today, and then turn the time over to Todd. Todd Foster is the head of product at HealthTree, and he is an IT healthcare executive who specializes in patient experience and clinical process improvements. Todd was director of patient and provider experience at MD Anderson for over a decade. Prior experience also includes leadership of IT development projects at Intermountain Healthcare and United Healthcare. Todd has a passion for using technology that can help patients have a better life, and along the way help to further research for a cure. Sahagun is an engineer and a psychotherapist. She has experience in both fields and loves them equally. She leads the patient experience team here at HealthTree, and she's passionate about talking to patients and empowering them. When she's not working, you'll find her exploring the world, eating different kinds of foods, hiking, or skiing. With that being said, Todd, I'm going to turn the time over to you, and we can get started.
All right, thank you, Audrey, and welcome everybody. It's a pleasure to be here with you today. I need to share my screen, don't I? Where'd it go? Can you see my screen?
Yes.
Okay, thanks. All right, so this is our HealthTree, the main site, healthtree.org. Sorry, I gotta adjust some things. Okay, now it's there. So this is HealthTree.org. If you come to this site, this is a newly launched site. It's changed about 3 weeks ago. And when you come to this site, you can see some things that HealthTree has to offer. And you can pick the disease you want to go to. Right now, myeloma, there's multiple myeloma or acute myeloid leukemia. We will be adding other diseases over time. But if you click on multiple myeloma, it takes you in to the HealthTree page for multiple myeloma. And you can see it may look overwhelming a little bit, but there's so many programs and different features that we have to offer. So we tried to kind of break them out into different categories of navigating, learning about myeloma, joining a community, finding support, or helping to accelerate research. And each one of these tiles takes you to different places within the system. The side effect solutions tool that we're going to talk about lives inside of curehub right now. So there is this tile right here in the middle of navigating your myeloma called HealthTree curehub. You can click on that and it will load. Takes it a second, has to come through a lot of data there to pull up, but it will load the HealthTree curehub site. And I think I'm just going to give you a really quick overview. There's this Track My Myeloma section that you can see in the left-hand nav here, where you can enter information about your story, your myeloma story, your diagnosis, your team, treatments, labs, imaging, all that sort of stuff. You can enter that information here. We do gather a lot of your medical information, and we wanted to give you something back in return for that. So we do offer treatment options, patient solutions we're going to talk about today, HealthTree University, the twin machine to find a twin match and see what treatments they've had, if they've worked or not. There's forums, it's kind of like a Facebook type, just some things to help you as you're navigating your treatments. So we are going to go into the patient solutions. And I do want to point out that all of this information has not been provided by the medical community. All this information is provided by patients just like yourselves. So it's a patient solution tool, and the information comes from patients. So if there's anything in here that you're interested in trying and you're not sure about, you should always check with your doctor before making any changes or adding anything that could affect your treatments. Always check with your doctor. The page initially, it loads all of the side effects that we have in our system, and these are side effects that patients have reported with their treatments. I think there's quite a few. We have like 112, I believe, different side effects listed in here. What I'm going to show first is that you can look at side effects based on drugs. So if you filter, let's say you're on Revlimid RVD. So let's select Revlimid, Velcade, and Dex. That's the treatment you're on, but your doctor wants to add Dara. Let's say your doctor wants to add Dara to that RVD treatment. So you can come in here and select Dara along with your RVD and save that. And the system's going to show you what patients have reported that are on those drug combinations. Right now, I've got it sorted by most common. So you can see the most commonly reported side effect for DARA RVD is fatigue. 57% of the patients in the system have reported fatigue. The average severity is 3. So 1 out of 10. So the severity level is fairly low for fatigue, but a lot of patients are experiencing fatigue. Again, you can see neuropathy, 43% of the patients that are on this treatment experience neuropathy with an average severity level of 4. And there's lots of different side effects that patients have reported related to this drug combination. So you can kind of get an idea if your doctor is going to put you on this treatment or add, in this case, DARA to the treatment. You can kind of look and see what you might be in for, what you can expect if you go on this treatment. You can sort the treatments by most common. So fatigue was found, it was most common. It was 57% of patients. You can sort them in alphabetical order if you'd like, or you can, excuse me, you can sort them by severity. So there's 2 side effects that patients reported: difficulty swallowing and hemorrhagic cystitis. The severity level is a 9 and a 7, so that's pretty high for severity level, but it was only found in 1% of the patients for both of those. So you can sort and search through these lists of side effects that have been reported with these treatments in any way you want. Let's say fatigue, you want to look more at fatigue. What are patients doing about fatigue? You can click on View Solutions, and we have 29 solutions that patients have reported that they've tried. So the most common, again, I'm sorting by most common, is rest. Take rest when needed, take short naps. 103 patients have reported that they have tried this solution. 92% said it was successful, 8% said no effect, 0% reported feeling worse. If we move to the second one, start an exercise routine to improve energy levels, stamina, and strength, we can see that 86% of 86 patients in the system have reported this solution, and 92% reported it was successful, 7% reported no effect, and 1% reported that it made them feel worse. And there are lots of different options that patients have reported. Take your medications at bedtime. Helps many patients. 65% of the 57 that reported that, feel better. Again, this is something you should check with your doctor about and make sure there's no problems doing that. And you can scroll through and just look at all these different solutions that patients are trying, and you can see if they worked or not for them, and maybe decide that you want to try some of these to help alleviate the side effects you might be experiencing. And again, you can sort them all by alphabetical order or the most successful. So the number of successes that it's reporting: 92% for rest, 92% for an exercise routine, 98% be flexible when you want to accomplish what you want to accomplish in a given day, maintain regular sleep schedules. It can be very helpful with medications you're on or that you may be taking if you want to find out, what's going on there. Let's say you have fatigue and you've tried something, and you scroll through this. I mean, there's 29 solutions here that patients have reported, but you've tried something that as you scroll down, you don't see it. You can tell us about that. Right here, this tile, add a new solution not listed. If you click that, you can enter the solution. I tried vitamins. I don't know, that may be in there, I'm not sure, but we can spell correctly too. I tried vitamins. We are going to ask you if you know which drug caused this, fatigue. It's going to select the drugs that you had pre-selected there. If it's a specific drug, you can unclick and just select the specific drug that could have been, that you think caused the fatigue. If you don't know, it's fine. You can just say, no, I don't know. And then you click next. And you tell us if it helped or not. Did this help with your fatigue? You can say it helped, it didn't help, or it made things worse, and then submit that. That comes to us to review, so you won't immediately see it showing up on your list here. We will review that and add it in if it's not already in the list, so that it will be available for other patients to see. And we probably get a handful of new solutions every week that patients are suggesting or that they are trying that they don't see in their lists. I'm going to go back. Okay, and I am going to clear out all of the drugs that I selected, the DARA RVD. So again, this will show you the list of all the side effects we have in the system. And oops, I didn't mean to do that. And you can, look through them all. Fatigue is the most common side effect that is reported in general with all patients. The next most common side effect that is reported is neuropathy. For many of you, that's probably not a surprise. So if we go into neuropathy, there's 73 solutions. That's a lot. 73 solutions that patients have reported to try to help with neuropathy. The most common, exercise to help maintain good blood flow. You can see again, 98 patients reported that, with an 87% saying it helped. Gabapentin, a prescription medication that can help. That's fairly common. A lot of people reported that, and you can see it's kind of mixed results if gabapentin helped. It helped for about half the patients, and then about the other half it didn't help, where it made things worse. Combination of different vitamins have been tried, not as good results as maybe you would hope. So if that's something you're thinking, maybe you come and look at this and think about, oh, maybe I should try something else, or I'll give it a try for a week or two and see what my success is on that. Drinking water, vitamin D. Let's say that you exercise for good blood flow to help with your neuropathy, and you want to say, I've tried this. You let us know. We want you to let us know what you've tried and if it's worked or not. All you do is click on I've tried this solution. Again, it's going to come up and ask you if you know which drug caused it, and you can, if you know, you can say yes and tell us the drug. If you don't know and you say no, it's the same as before. You just click next and you say if it helped or not. And then you submit that. And now you can see that 98 patients reviewed this, went to 99 patients, because we just reviewed it and we gave it a success rating there. And then it won't let you vote on that once you have already told us that you've tried the solution. It'll tell you that you've already reported what you've tried for this solution, but the others will remain in the blue link that you can click on. So we really encourage engagement here, because the more people that are telling us what they've tried, the better type of research tool this becomes for other patients. So by you telling us what you've tried, you are actively helping other myeloma patients make decisions about their care, their life, and the quality of life that they have. Each of the side effects that you come into, a long list. I'm going to scroll clear to the bottom, but at the bottom of each list, we have our forums related to neuropathy. So you can also come in here and read what patients are saying about neuropathy, their experiences with it and what they've tried. Neuropathy, again, because it's so common, there's a lot of communication going on in the forums about neuropathy. And you can see if people have replied. So if I click on the 6 replies, there it goes. It'll open up those 6 replies that you can read, of what people are saying to Joan's post here. You can favorite one if you like it, so that you can easily get back to it. You can share it, and you can reply yourself, and you can click here if you find it helpful. So that's something that patients like, and that's tied to the side effect solutions as well, is to read what other people are experiencing about a particular side effect. Let's see. So that's the basics of this tool. It's not too complicated. We created this, at the time we created it, we didn't know of anyone else that was doing anything like this. There are a few other organizations that are trying to do something like this, but we created this for you, the patients, because it's one of the most common things we hear back from patients is, I tell my doctor about my side effects, they note them, but then, they never do anything about it, or they forget about them, and they can't find what I've said. And that's because the EHR systems that they use are not designed that way. And like, if you look in Facebook groups or people that we talk to on a regular basis, side effects is one of them. It's the most common thing that people talk about, with reason. You can definitely understand why. So that's why we built this tool, is to try to help you all through this cancer that you're fighting through, to help you hopefully have a better quality of life. So I think we're done a little bit early.
Okay. That's great. That's great. Thank you so much, Todd, for taking the time to go through that and working through the details. And I hope that our audience was able to see the benefits that can come from a tool like this. One of my favorite things about this tool is it's literally going to help further myeloma research, because the doctors and the nurses are going to be able to have this information and understand what is really working for patients, what it's not. They'll get this information by you bringing it to them. Of course, we don't share any information without your permission. I didn't want to say that, but we are going to be able to help one another and help further myeloma research by reporting on our different side effects, what's working, what's not, what different side effects are from certain medicines. And we're able to work together to create a stronger and a healthier myeloma community. So that's encouraging. And thank you for all your work that you've done on this, Todd. It is now time for question and answers. So if you see the Q&A icon, if you click on the screen where you can see Todd's screen, and then at the bottom, it's a little Q&A. You're welcome to enter your questions there that you have. It can be patient solutions or side effect solutions, we call it both. It can be related to that. It can be related to HealthTree curehub in general. It can be related to other programs or products that the HealthTree Foundation has. Considering there's 3 of us here, we're more than welcome to, you're more than welcome to ask anything that you would like to. One of the questions that we get commonly, Todd, while we're waiting for people to enter their questions is, do you need a HealthTree curehub account in order to participate in side effect solutions?
Right, that is a great question. So yes, right now you do need to have a HealthTree account with curehub in order to tell us if you've tried something, or if you want to add a new solution, any type of interaction where you're telling us something, you do have to have an account. We are working on opening this up on the outside, if you will, which means so you can see this without an account. That's not available yet for Myeloma, but it will be. So that you can come in and use this as a research tool, whether you have a CureHub account or not. You'll be able, you can come in and look at this. But like I said, if you want to say I've tried this or add a new solution or interact with the forums by replying, it will make you sign in to an account. And if you don't have an account, it will make you create an account so that we can, for just tracking purposes, so that, like we talked about, if you've clicked on I've tried this, you need to have an account so that we can tell you you've already reported on that and that sort of thing. So yeah, great question. Right now, yes, you do have to have a HealthTree CureHub account, but we're working to bring that on the outside for you as well.
Okay. Another question, what if I report on a side effect solution that works for me, but later it ceases to work? Is there a way that I can report that it only worked for a certain amount of time?
That is a great question. First time I'm hearing that. Don't know why I didn't think about that sooner. So right now there is no way to kind of change, if you come in here and you said, physical exercise, it worked, but now it's not working or it started making things worse. Right now, we do not have a way where you can change that, but I will add that to our list of features to consider adding to the product. I think that's a valid request or feature that we should have in this tool is to be able to modify what you've reported.
Okay, perfect. Another question I had, another comment I had, I was like, wait, I didn't have a question. Another comment that I had about that is the forums. That would be a good place for the forums as well. Is we're able to, that's where you're able to put, while I did try physical exercise for the first 3 months and it wasn't working, and finally in the 4th month it started to alleviate my symptoms. I think if you want to go into further detail, the forums would be a really good place for that.
Yeah, great comment and addition. You're right. And that's what a lot of people are doing. They go into a lot more specifics in the forums, which people really like reading and learning about, the specifics that people are talking about. And that's why we added the forums down below each of these sections for that very reason. So yeah, great comment, Audrey. Thank you.
Yeah. Alessia says something important. She said, I prefer everyone needs to have an account in order to contribute because that keeps everyone accountable. If I'm sharing my information, so should others. I love that. And then there's a question regarding, yeah, it's kind of a, helping your community. You're willing to contribute in a way that's validated, so we can know that you're a real myeloma patient and are actually experiencing these side effects. We don't want these to be inaccurate, which is another one of the reasons why we have people create accounts in order to contribute. There's another question regarding vitamins and supplements. So they want to know, how do I know that the contradictions related to my treatment are taken into consideration? So we often know that there are certain vitamins or supplements that could maybe interfere with chemotherapy. And I think this is where this question is going. How can we take that into account when going through side effect solutions?
Yeah, great question. Grapefruit is a common one as well that can affect your treatments that you're on, as well as vitamins. So it's a very good question. It's a valid question. And it is a question that should be asked of your provider or your care team. They are the ones that would be able to answer that. We do get people when they click on add a new solution and say they put in vitamins, and they'll put in comments, you should take 5 milligrams of this and 10 milligrams of that and do it, they'll give very specifics, and we purposefully don't include that into all of these solutions. because your doctor needs to know that you're thinking about taking the vitamins and needs to be okay with that. So it has to be a conversation with your doctor. And your doctor should know about the contraindications of whatever it is you're thinking about taking, and if it can affect your treatment in a negative way. And then he or she would tell you, or should tell you, it's fine to take vitamins, but take them at noon or something instead of morning or evening. That type of conversation is what needs to happen with your care team. So hopefully that answers the question.
Yeah, I think this is good. Anna, a question for you, just with the experience that you've had with your team and the interactions that you've had with patients. Steve is wondering, after his chemo transplant treatment he had very little side effects and he's in total MRD remission. He's wondering if the severity of side effects change over the years, if they get better or worse. Based on what you've seen, could you obviously not answer that in a medical format, but answer that in the way that you've seen it with your patients that you interact with?
Yeah, it does get better, but we can actually make more research for you and get back to you on that.
Yeah, I would say generally what I've heard is, especially after the stem cell transplant, things just continue to improve, especially if you're showing MRD negativity. That being said, that doesn't guarantee a smooth ride, and you'll always want to be in contact with your doctors and your treating physicians. If any side effects do arise, or if something's not just not sitting right with you, you'll always want to be in constant contact, because it's way better if you discover those things ahead of time and are proactive about how your body's feeling, just doing check-ins with your body. So can't guarantee a smooth ride, but hopefully things get better from here. And congratulations on MRD negativity. That's really exciting. One of the things that I was going to mention as we're waiting for more questions to come in, if anybody has them, is as you were mentioning, Todd, we see a lot on Facebook, what works for you and what doesn't work for you. And while it's nice to have that on Facebook or other social media platforms, we wanted to create, as we were saying, places where validated patients can come in and report on what actually is working and what is not, because myeloma is such a unique disease, and what works for one person isn't guaranteed that it's going to work for another. So by getting mass numbers reporting on the side effect solutions, whether it works, whether it doesn't, we're able to give you more accurate representation of how to help with those side effects, or what side effects to expect with different medications. So just a background of, not saying that you can't ever ask on Facebook again, or that Facebook is bad, but by all means, if you see somebody that's asking about a side effect, feel free to put HealthTree.org in the comments and say, check out their side effect solutions, because they have accurate, exciting data that actually works. So anyway, I just wanted to give that little plug in there for the patients that are out there, because we work really hard to create these products and we want to share them with others, and you can help us share them, and other people deserve accurate answers as well. So
and just a follow-up. Oh, sorry, Audrey. Just a follow-up to that. Yeah, Facebook, it's not bad. It's a great place for people to get information. But as we started developing this side effect solutions tool, we wanted a place where you could come back to and find the same information easily, or remind yourself about something that you knew you saw, and to easily get back to that place and find it. And that's one of the problems with Facebook is, the feeds just scroll on and on and on, and eventually you can't find something that you once had or were looking at. And so that's one of the reasons we created it the way we did, so that, if you have anxiety and you couldn't remember some of the options, what people reported, it's easy to come back and find those and see the numbers associated with that. So that was one of the goals that we wanted to accomplish, is to provide a way for patients to get back to the information that they once saw, find it easily, and remind themselves of it.
Perfect. We don't need to go any longer than is needful, so I will give a couple more minutes for questions. Another thing that I wanted to show on here, it is very separate from side effect solutions, but did you want to show them how they can fill out different surveys for research, Todd? Just talking about research in general, I wanted to show them one more thing that they could do within HealthTree curehub to promote research.
Sure. Accelerate research over here in the left-hand nav is where you can participate in that. So if you click on that, we have various surveys and studies that are available, that are open. Two of the surveys are a patient perspective on cure in multiple myeloma, and feelings, fatigue, and fitness in myeloma is the other survey that's going on. Generally, some of these are promoted by us, by HealthTree. Most of the time, there are specific myeloma specialists that are asking us to put these surveys out here to get your answers. And then there are studies, multiple myeloma genetics and real-world outcomes. These are studies, the effects of exercise on smoldering myeloma patients, and you can answer these as well. And generally, the studies will turn into research and different things that are published on. And this is one of our most popular features, actually, of HealthTree curehub, is this accelerate research section with the surveys and studies. People want to help, obviously, for obvious reasons. We want to help research and find cures quicker. And just to help you understand the impact of this by you answering a survey, it literally takes years off of the research study time. A lot of the drugs, the new drugs that are coming to market right now, started development 17 years ago. One of those reasons is because of this research that takes so long. We had a doctor come to us, some of you may have heard about this, but it's the one we commonly use, about vaccines after stem cell transplant. And, he had spent years trying to get patients to answer 5 questions about if they were vaccinated after a transplant or not. And it was like 50 patients after 2 or 3 years. And so he came to us and we put his questionnaire in our surveys here. And within a month, we had, I think I just forgot the number. It was well over 600 patients that had answered his questionnaire about vaccinations. And he was, so we did in a month what he couldn't, what was hard to do in 2 years. And that's how we shorten the time of getting new medications to market that can help us all live longer. And there's other examples of that too that we've done with these surveys and studies. So the accelerating research and the patient solutions are the 2 most popular features right now in curehub, the pages that people are going to the most. One thing I forgot about at the very beginning. When you first come into curehub, if the Track My Myeloma section, if you haven't completed this Track My Myeloma section, you don't see this left-hand navigation here that I've been using to get to the different areas of the program. But you will, there's a little onboarding tool where you can see exactly what you've done, what you haven't done. But all of these tiles here will be there if you haven't completed the Track My Myeloma section. You just have to scroll down, and that's where you can get to patient solutions. That's where you can get to accelerate myeloma research if your left-hand navigation isn't there. That's where you get to the forums, treatment options, clinical trials, everything is here. You just have to scroll down if you haven't completed your profile yet. I wanted to point that out because a lot of people come and don't have the left-hand navigation and don't know where to find it, so they give up. But it's all in these tiles that if you just scroll down, you'll see them all.
Perfect. Thank you, Todd. Anna, we have a couple questions if you want to help answer those.
Yeah, so Todd, Anita is wondering why it said edit answers in the surveys. Anita, this is because this profile already answered those surveys. So that's why it says edit. But if you haven't completed the study, then it would just say, how does it say, start or
Start.
answer, something like that. So you'll be good. That it's just this profile.
Yeah, it just lets you go in and see your answers if you've already answered it, is why it says edit answers.
Mm-hmm. And then Jen says that it needs to update your labs and imaging, and if we can help you, for sure. We can help you at any time to update your information. The process is, well, it depends if you already connected your records with us or not. If you want to check where in the process you are, you can just, you'll see in your bottom right a chat icon when you log into curehub, and you can ask us there. So you can ask if we can update it based on the information that we already have, or if you need to do anything else. And we'll be happy to update that for you. You can also email us at support@healthtree.org, and we'll be happy to help you. So yes, if you've connected your record, it's going to be faster.
Okay, there's a couple more questions. So I'll start with Steve's. He says, I only see my doctor once a month now. What changes or symptoms may develop, and then should I call him between visits? I would ask next time you go what he recommends you calling for. I know that nurse navigators or the head nurses are really good at these institutions. Even if you have a cold, even if you have minor body aches, feel free to call. They're not going to be mad that you called asking for help or asking for guidance. And it's better to take care of yourself and make sure that there's not any problems than wish you had called earlier. So feel free to talk to your doctor about that, your treating physician. But in reality, with these side effects, you always want to be in constant communication with your doctor, because you'd rather hear them say, I'm not too worried about that, keep an eye on it, versus why didn't you call me earlier? So that is my advice to use, to stay in constant contact with your doctors and nurses. And then Anna, do you want to answer Penny's question?
Yeah, and I would also add that it's hard to say right now because we don't know what are you taking, at what stage of your myeloma you are. So that's great advice. So Penny, you just added another medical facility for automatic upload. And how long does that take? So right now we're still working on the to make it automatic. It's not ready yet. We're kind of doing a process that involves human intervention. So we have a waiting list, and the times depend a lot, but I'll have one of my agents check your profile right now, and they'll get back to you today with an answer, and we'll be happy to prioritize your records so you can have them as soon as possible.
Todd, did you want to show them something on the screen?
Well, I was just looking at the next comment about I'm on Daradex and Rev, and the biggest issue is skin problems. And this person has been prescribed some creams by dermatologists that state that they're not to be used if a patient is immune compromised. And so this patient's not sure what to do. Neither is their oncologist, and asking if we've come across this before, or is there anything we can share? So we do have a side effect of skin changes, the thinning skin or discoloration, not exactly what this patient is talking about. And what we only have 3 things in here, and none of them are a prescribed medication by a dermatologist. I don't know if we have any other type of burning or stinging of the skin, skin changes. Those are the 2 we have related to skin. I think it surprises me a little bit, I guess, that your oncologist is unsure if this cream shouldn't be used or not if you're immune compromised. I don't know, Anna or Audrey, do you have any other suggestions?
This is one of, oh, can you hear me? Yeah, this is one of the things that I would ask in those forums so that you can get more feedback from people. And then I would also seek a second opinion with a different oncologist or with a different dermatologist, trying to ask them the question. So I would first of all go to the original dermatologist who recommended it for you and explain, I am immunocompromised. Why is this warning here? And would you recommend it still for me, knowing that I am a cancer patient? If they're still unsure, that's when I would seek a second opinion from a different oncologist, explaining the situation and seeing if he has had any other patients that are in the same situation and what did they do in order to help their treatment. So unfortunately, it's going to take a lot of work on your end. You're going to have to be your own best advocate, Suzanne, but I really know that you can do this. And Jan is also commenting sometimes seeing a pharmacist would help. And I agree with that as well. So just seek different opinions and make sure that you are listening to your gut as well in your mind and trying to make the decision that's best for you as you consult these healthcare professionals. So that's the best advice that we can give. But I would, again, put it in those forums to see if you can get anybody that is in the same situation and what they did.
I just had another thought about that you made me think about, Audrey, for Suzanne. We do, like every other week, we will send out an email to all of our curehub users asking them questions like this from patients. I can reach out to you, Suzanne, to see if you're willing to have, this question be sent out in an email to all of our users. And generally we get a lot of feedback when we send out those emails, 50, 60, 70 different types of feedback answers from different patients about what they think or their experiences. So Suzanne, if you're open to that, I'm willing to put this question out there to the whole community and see if we can get some answers. Cool. I saw your response, Suzanne. Yeah.
She is willing. That's awesome. Another question, is low blood pressure on the list of side effects?
It is, yes.
Can we look at that?
Get it back.
Another option that they're asking for is if there's a search bar at the beginning that they can search their side effects.
Okay, so blood pressure, we have high blood pressure as in hypertension, blood pressure of the lungs, pulmonary hypertension, and then blood pressure low, hypotension. And this was about low blood pressure, right?
Mm-hmm.
Yeah, so not as common. Only 2 suggestions so far from patients, and drink plenty of water. It looks like a prescription called Florinef. And that only 2 patients have reported using that. And it was, one patient had success, one didn't. Drinking lots of water seems to be a little more successful for patients.
And then also, sorry to interrupt you, I was just going to say, if this person has tried a solution that's not listed on there, this would be a great case when you only see 1, 2 solutions. If you're able to add something, whether it worked or it didn't work, it's still really nice to be able to add that solution that you tried so that your community who's also being affected by the side effects can get that immediate feedback.
And you can see there are a couple forums entries here from some people that have experienced it as well with some thoughts. So you're welcome to read those as well.
Awesome. Well, this has been a really productive session. I do want to give a couple more minutes because we've had such an influx of questions. So I appreciate the participation that you guys have had to given today. And
real quick, Audrey, what was that? You said there was something about searching and I forgot.
Yeah, so just like because the list is so long, they were wondering if there could be like a little search bar where they can type in the side effect that they're experiencing to see if it appears instead of trying to search through the whole page. Okay.
Yeah, so we are working on a search ability to search. There are a lot. Mm-hmm. So unfortunately right now, depending on what type of computer you use, but generally a Control or Command F for find brings up this little box, and you can, I typed in skin to look up the skin issues where I found the 3 different options there. You can type in things that way for now to try to
Mhm.
help you find what you're looking for, or especially like if you go into neuropathy where we have, what was it, 70 something 73 solutions, so you can do that control or command F and search on exercise or whatever you want to search on and
Or even
easily,
prescription or something.
yeah.
They can see the various prescriptions.
Oh,
Yeah.
that's right. I did forget to tell you, the show
Oh,
all
yeah.
solutions. I totally forgot about this. This is kind of a search, a little bit of a filtering search for you. It's set to all solutions, but yeah, if you wanted to find prescriptions, you could click on that and click on prescriptions, and it will only show you the solutions that have been entered that are a prescription. If you wanted to look at, I don't know if there's beverages and food. There's one, apple cider vinegar. That doesn't sound tasty. Self-management. So all of these categories right here, you can search on that in this show filter. So that may help a little bit, but we are working on a search ability just for exactly that.
Perfect. Thank you so much. And thanks again for all the work that you and your team are putting into it. And Anna, thanks to you and your team for always helping our patients and leading that patient experience team. We're going to finish with some outro announcements. So we've talked a lot about research this time around. Oh, we do have one more question. So I want to make sure that we hit that just because we are a little bit before time. So Annie's saying that her mother is on treatment, and then that, their mother is on treatment, and that it's has problems with sweating, and none of the doctors have paid attention to this and checked HealthTree and found this in about 5% of patients. I hope it's just a side effect, but based on your clinical experience, could it be something related to myeloma? So let me just say none of the three of us are certified medical professionals at all. In my personal experience with my grandma and my friend that were diagnosed with different cancers, they also had excessive sweating. That being said, it could be a cancer thing. Again, if your doctors aren't paying attention to it, I would talk to your nurses if they see this across patients. If your nurses don't listen to you, I'd seek second opinions, just because these feelings matter and you do worry about them. And especially if it's your mother, you're a little bit nervous and want to make sure that everything's okay with her. So while I can share with you personal experiences that I've had in my own life as a caregiver, I will say I would go to your nurses, her nurses that are treating her, and see if they have any comments on it, or if they see this across the patients that they see, or if they've heard of this before. Todd or Anna, do you have anything to add with that?
I'm just looking it up. So somewhere in here, she found sweating in 5%. I would say if 5% of the patients have reported sweating with that drug combination, it's right there, 5% with an average severity of 4. So it's about almost in the middle. It's most likely related, I would think. It's not a coincidence, I don't think, that 5% of the patients, I mean, we have 10,000 patients in the system. Not all of them have put in their treatments and side effects, but we have a lot of patients in the system. And so 5% is not a coincidence, but the advice Audrey gave you, I agree with as well.
Awesome, thank you. All right, so thank you again for your participation here today, for taking the time to be with us. Our next meeting is going to be on March 9th at 1 p.m. Eastern, and we're going to be talking more about furthering myeloma research with Nathan Sweeney, who is head of research here at the HealthTree Foundation. He's going to be sharing more of those surveys and those studies, what the results are, and how exciting it can be to contribute to research and what the doctors can do with research findings through HealthTree curehub. So we're excited to learn more with him next month. You may be also interested in other Myeloma Crowd community events you have coming up. The 15th, we're going to have our selinexor support group chapter. We're going to hear from Dr. Jeffrey Zonder as he talks about selinexor combinations within clinical trials. On the 16th, we're going to have our Mountain West Myeloma chapter, which is going to be Know Your Myeloma Labs. This is from Takeda PALS representative Rebecca. This meeting will not be recorded, so if you do want to attend this, make sure that you attend live. The 17th at 1 p.m. Eastern is newly diagnosed myeloma patients chapter. We're going to be hearing from Tony Newbern, and he's going to be sharing his stem cell transplant experience. And this is in partnership with the Multiple Myeloma Journey Partner Program. The link to sign up for any of those events and many more events that I haven't mentioned today is found at the bottom of the slide, and it will be sent out in the follow-up email within 48 hours of the event's conclusion. Another thank you to our sponsors, Bristol Myers Squibb, Amgen Oncology, Genentech, Adaptive Biotechnology, Sanofi, Janssen Oncology, Karyopharm Therapeutics, Takeda Oncology, and AbbVie. And a big thank you again to all of you, to Anna and Todd and your teams for helping us build a strong myeloma crowd community. I appreciate you and hope that you have a great rest of your day. Thanks so much.